It's not something you probably think much about, but did you know that your liver plays a critical role in your body's digestive system? Everything you eat or drink, including medicine, passes through it. My name is Gloria Milimu, and on this episode of Health Digest, we look at liver diseases and why doctors advocate for the need to protect this intricate organ. Ann Loko, a resident of Nairobi, got a new lease of life 27 months ago. What manifested as a skin disease before progressing to other health-related complications pointed to an underlying illness that would later result in a chronic liver failure diagnosis. Before the life-altering diagnosis, the Nairobi resident says she had to undergo a battery of tests to determine what was preying on her health.
During that time, because we did some lab tests, they discovered that I was anemic, my white blood cells were low, and I had very low platelets. Right? So I needed to see another specialist to look at my blood work because it was deranged. I was hospitalized, diagnosed with another autoimmune illness. And then later, after scans and MRIs, they discovered that also my liver was very small, and then my spleen was very enlarged, and that was causing the low platelets. So I was diagnosed with liver cirrhosis.
Like many patients diagnosed with end-stage liver diseases, her doctor recommended a liver transplant, said to be key in prolonging and improving quality of life of patients like her.
When I was diagnosed when I knew that I needed a transplant to survive, my sister offered to donate part of her liver. So she donated about 60% of her liver, but it grows back again.
Experts say that after transplantation and liver function is restored, many metabolic alterations are corrected. However, patients like Loco have to contend with lifestyle changes as part of the modifications to ensure their health remains in check after the procedure.
Now, post-transplant, I have to take very high protein diet. Specifically, no red meat, but I eat a lot of chicken, fish, nuts, almonds specifically. Yes, because I need to eat that every day. And also there's a neutropenic diet because I'm immunocompromised. So because of the medication I take, I'm immunosuppressed, right? So you're not supposed to eat raw foods like sushi, raw fish, raw milk, the raw milk that you get directly from cow. Sometimes buffet food. Yes, the food has to be fresh, clean handling of food.
Like Loco, Winnie Miano's diagnosis also took a while. She was diagnosed with fatty liver diseases in 2016. Doctors attributed it to an excessive weight.
I was quite obese at that time, so I was advised to lose some weight, which I did up to around 70 kilos. So after getting to my 70 kilos, I thought now the issue is over, which was not true because it came back in 2022. Is when around September, October, I started feeling just a bit fatigued, tired all the time, feeling like I have malaria, those symptoms of like getting out of bed is a problem, muscles are aching, like that. So eventually I started deteriorating and started getting some pains. I had zero appetite actually.
However, despite losing weight as had been recommended, her symptoms persisted, compromising the health of her liver further.
They did a lot of imaging and all that and discovered that it was really serious and could not be compensated. So there was no way I could reverse the process. because most of it was really covered by the fat and it had dried. The fat around it has made it harden, so nutrients cannot penetrate. So it's when they recommended liver transplant.
Like many patients who are forced to undergo the life-saving procedure, finding a donor became her biggest nightmare.
At first it's quite a shock to hear that you need a transplant, and what goes through your head is, who can give me a liver now? So of course, as a human being, the first thing would be like, why even hassle, why even bother? Yeah, I think it's okay, it's all right, let it be. So my family was like, no, we are not giving up, let's do this, let's give it a try.
Dr. Chris Opio, a gastroenterologist at the Aga Khan Hospital, explains that liver diseases can be caused by several factors, which can present differently in both the adult and pediatric populations.
Overall, you may have infections, and the infections may be viral, so you have hepatitis A, B, C, D, E. You can have other infections, for example, bilharzia or schistosomiasis. You may also have yellow fever. I think you've heard of yellow fever, and there were outbreaks. Even dengue fever can cause liver damage. When you go over the infections, then you may have toxins, for example, drugs, herbs, and alcohol. For young people like you may come down with hepatitis A, which is spread through water and through contaminated food. So we get quite a number of individuals who have hepatitis A. Hepatitis B is also common. Hepatitis C is not very common. So I would say non-alcoholic fatty liver disease, the hepatitis A and B, all right? And for children, there are other causes. But you should not forget even drugs themselves, medications. The liver processes the drugs. So some of the drugs can be toxic to the liver.
Experts say liver diseases have become more common than ever, with fatty liver diseases taking the lead. They warn that if left uncontrolled, they can cause permanent liver damage.
So for those communities, if they are adults and they do not consume alcohol, there is what we call metabolic associated fat or fatty liver disease. So the fat acts almost like alcohol and can destroy the liver, and it can also lead to other complications. For others, sometimes their bodies react to themselves. We call it autoimmune liver disease. So when your liver is seen as foreign by your immune system, then your immune system attacks it and destroys. That leads you to have liver damage. From the few studies we have done, we can say about, for example, hepatitis B, it may be about 3% who have, in the population who have hepatitis B. Non-alcoholic fatty liver diseases can go up to 15%. In diabetes, if you have type 2 diabetes, it can go up to 50%. So you'll have 5 out of 10 individuals with type 2 diabetes having non-alcoholic fatty liver disease. For alcohol, it may be around 1 out of 10. It depends on the community.
Dr. Opio warns that fatty liver disease symptoms may go unnoticed, leading to late diagnosis.
Basically, people need to go for screening because most of the time we're walking around and we don't know we have liver disease. So the liver is the biggest organ in the body, and for you to have symptoms, you need to destroy more than, say, 70% of it, okay? So most people will be walking around, they may have liver disease, but they do not know. So the only way to know whether you have liver disease is to get screened or get tested. And there are various methods. You may do an abdominal ultrasound scan, you may do a blood test, which may tell us something is going on. If in doubt, sometimes we may do liver biopsies, but we do not want to go there.
The liver plays a critical role in the human body. Doctors say it's the body's primary metabolic and detoxification center. It performs more than 500 vital functions, yet it is often overlooked. Dr. Juliana Mwiva, who is a pediatrician and gastroenterologist at the Kenyatta National Hospital, says a large spectrum of diseases can cause liver disease among children.
Very often what we see starting even as early as the first day of life, we may have a baby who's born with very high levels of bilirubin, which presents clinically as jaundice. Jaundice is when you have a yellow discoloration of the eyes, the white of the eyes, and also of the skin, which is easy to see in newborn babies. Later on, these babies now begin to present with other features of liver disease. They may have poor growth, poor feeding. They may also show signs of general instability. They may have bleeding disorders, and etc. I'd like to mention at this point in time that not every baby who has jaundice early in life has a liver problem, because there are babies who are born and the jaundice is actually attributable to differences in blood group between mother and the baby, or other factors which are not necessarily due to the liver. However, the particular subset of babies that we're talking about in neonatal jaundice, neonate is that newborn baby. The particular subset of babies that we're talking about tend to have intrinsic liver disease. Intrinsic meaning this particular disease is coming from the liver, and it manifests therefore largely with jaundice, sometimes with poor feeding. It can come looking as an infective illness, and it can also manifest in other ways such as a swollen tummy and sometimes in bleeding disorders. So when we see these babies, we want to work them up to try and understand what is the origin of this liver disease. Unfortunately, we have a very large spectrum of diseases that can cause liver disease in a newborn baby. And so there's an extensive workup that needs to be done. We often attempt to take our patients through this workup and see what kind of interventions we can put in place. Now, there are certain diseases that for us give us more complications than others. One is a disease called biliary atresia. Now, what happens in biliary atresia is you have a baby born with a biliary system that was not well formed in the womb, or shortly after birth, the biliary system undergoes a progressive destructive process, and then that means that now the baby's bile, which should normally be removed from the body, can no longer be removed. It is recirculated within the body and begins to destroy many organs, starting with the liver itself. So for such babies, since if they come in early, we are actually able to try and find a new conduit for the bile flow to be re-established through an operation. But if they come in late, or if the operation is unsuccessful, these are the babies that we commonly refer for what we call a liver transplant.
This life-saving procedure that replaces a damaged liver often involves doctors performing surgery on both the donor and the recipient. A whole liver may be transplanted or just a part. In most cases, the healthy liver may come from a deceased donor or a healthy living person.
For a little baby to get a transplant, it means somebody must be generous enough to give a small portion of their liver to this baby in order to help the baby survive. So the native liver, the one you are born with, is taken out. You get the donor liver, we place it in, we do the connections, and a majority of the time that liver works well and the child can come back, but will maintain chemotherapy for life to prevent rejection of the new liver.
The liver is the only organ in the body that can regenerate. In the case of babies, however, those who present with progressive liver disease cannot benefit from this type of treatment. Dr. Mwiva warns that the risk of mortality among this group is often high.
Weekly, we run a pediatric gastroenterology and hepatology clinic. Weekly, we would say that on average, we see 5 to 10 children with liver diseases. So that's a significant number. In a year, it would be still a large number, but I would say that at least for biliary atresia, every year in this institution, we see an average of 30 to 40 children with biliary atresia. Not all of these are able to access transplantation. Firstly, because some of them are very late presentations, they're not stable even to undergo a transplant procedure. Some of them, it is due to socioeconomic restraints, so they cannot access the procedure. And some of them, of course, are lost to follow-up. We're never really sure what happens to them, but we know biliary atresia has a poor outcome. If you don't get this child transplanted within the first 1 to 2 years of life, we stand a very high chance of a mortality in this child. When we look at the older children, a majority of children actually don't generally tend to present with liver disease, except for illnesses which are acquired, such as the hepatitis B virus, which again, if we prevent this infection at birth and the baby goes through the 6-week, 10-week, and 14-week vaccinations, we will be able to make sure we have a large population of babies and children who are vaccinated against hepatitis B. But what we tend to see very often is hepatitis A virus infection. And hepatitis A virus, you know, the children will suddenly come one day and they look like they're getting sick. And the sickness normally presents like a malaria kind of sickness. Child is ill, a little bit of fever, tummy upset, some abdominal pain, nausea, vomiting, doesn't want to play much, you know. Then we see the jaundice come up and then we begin to realize this actually is a liver disease.
Similarly, misuse of conventional and herbal medicines among pediatrics has also been cited as one of the major factors contributing to poor liver health among children.
In the older population as well, and in actually all age groups in pediatrics, we worry about paracetamol poisoning in overdose. And sometimes parents are not aware that they're overdosing the child with paracetamol. So we normally recommend that please give your medicines according to the prescribed schedule and from a professional healthcare provider. So not just from anybody. Another common problem that we see in children is also herbal intoxication. So what this does is that this leads to acute liver failure because sometimes the combination of herbs is such that it poisons the liver instead of helping the child. The herbs may be administered for a non-related illness. Some children had diarrhea, they were given herbs. Some children had a wound, they were given herbs. Some children had headache, they were given herbs. But these herbal preparations sometimes end up poisoning the child and destroying the liver.
The gastroenterologist also warns that other factors like aflatoxin poisoning also adds to the burden of this disease among children.
We've seen this in areas where people consume a lot of stored grains and the grains are not stored properly. So aflatoxin is it's a poison generated from grains that are stored improperly and begin to have fungal growth on them. So the fungus leaves the toxin in the grains, and then when the grains are consumed, these children tend to suffer from aflatoxin poisoning, which is also quite a big thing.
Compared to children, most liver diseases among adults are acquired. However, Dr. Mwiva explains that many infections that lead to failure of the organ cut across these demographics.
Acquired liver diseases, I think the biggest one is again hepatitis B infection and its sequelae having acquired this infection, hepatitis C infection and its sequelae. But another big acquired liver disease is alcohol intoxication, because especially chronic alcoholism, that can lead to progressive damage in the liver, which leads to something called cirrhosis, which is a very hard, firm liver that is not functioning well. And then eventually, within that hard liver, you can now begin to get complications from the cirrhosis and you can begin actually to develop cancer. So both hepatitis B and the alcoholism can eventually lead a patient to developing liver cancer. Liver cancers are not that common in pediatrics. The good thing about pediatrics also is if we understand the etiology, the cause of this disease, we're actually able very many times to put in place therapy and provide care that can prevent progression of this illness and perhaps in some cases reversal of the illness. So children, The other thing about liver disease in children as compared to adults, an adult is a fully grown individual. With liver disease in children, we tend to have smaller children. Their growth is affected. They don't feed well. If they feed, they're not able to fully competently absorb the nutrition they have taken in. For adults, that is still a big challenge for them, but this is already at least a grown individual. So we also have what we call congenital liver diseases, which is something about the way the liver is formed during pregnancy and maybe shortly after birth, and we don't tend to see the spectrum of disease in adults often.
Just like many countries in the sub-Saharan region, lack of liver transplant facilities to facilitate access to the life-saving procedure in Kenya remains a major barrier to treatment for these patients. Consequently, patients are forced to shoulder the high costs that come with seeking these services further afield. This was the same case for Loco and Miano. They got a new lease of life. But currently, the high cost of ensuring their bodies do not reject the new organs is presenting a whole new challenge.
The costs post-transplant are ridiculous. It's very expensive because the first year I did the transplant, I was spending about 50,000 per month.
Well, there was a medicine I was using that is 18,000 per packet, and I needed 3 in a day. So you can imagine. That was quite pricey. So then moving on to India, if you add the total amount, I spent close to 9 million.
So what NHIF should be doing, I think, is to support post-transplant patients, all post-transplant patients, to get medication so that you're able to preserve the graft, the donated organ, and also if we can have early detections so that people don't need to go to transplants. I mean, doctors should be aware of these symptoms, symptoms of liver failure, so that you don't have to get to a stage where you need a transplant. With early detection, then you avoid getting to the end stage, right, where you need to do a transplant.
We know that our health systems can be a financial burden to us. Okay. So, but at the end of the day, I think it goes back to the community, and the community means that there are people out there and also the ones who are legally responsible for our health. Yes, we are legally responsible for our health, but it's the Constitution. What does the Constitution say about health? You're supposed to provide a level of health. So such patients, I believe, should be supported. There should be a reasonable budget for them. And there should be systems. The health insurance should be able to take care and to provide for them, in my opinion. Yes, you may have philanthropists, you may have companies that may support them, but I think, and then also the patients can participate in groups that can help themselves. So there are various avenues, but I think the buck stops with the government at the end of the day.
Experts say by being vigilant about liver disease signs and proactively seeking medical evaluation, individuals can take the necessary steps to manage liver diseases before they progress to severe liver complications. The liver is an integral part of the body. As Kenya joins the rest of the world to create awareness about liver disease, doctors recommend that you should limit alcohol consumption, maintain a healthy lifestyle, and minimize exposure to toxins, among other recommendations, in a bid to maintain a healthy liver. Gloria Milimu, KTN News.